Irritable bowel syndrome defines irritable syndrome as a disorder of the digestive system, especially the large intestine, and affects bowel function and movement without damage to the tissues of the gastrointestinal tract. The patient also has a number of symptoms and signs, and irritable bowel syndrome is a chronic disease, and it is worth noting that some people with irritable bowel syndrome can control the symptoms associated with it by paying attention to the diet and lifestyle followed, in addition to mitigation. If these symptoms are severe, they can be treated with medication. 1-2. Volume 0% Irritable bowel syndrome. There are three forms of symptoms of irritable bowel disease, which depend on each other's exogenous habits, namely diarrhea predominant, constipation predominant, and the pattern that combines the two previous types of alternating constipation and diarrhea. 3. Some irritable bowel syndrome may occur when exposed to stress, a particular diet, lack of sleep, or some changes to bacteria in the intestines, including 4. Flatulence, bloating and gas increases are one of the most common and annoying symptoms. Pain, the most common symptom of diagnosis of the disease, and in the form of pain or colic in the abdomen, especially in the lower abdomen, where digestion is regulated by a number of hormones, signals, and nerves, produced by beneficial bacteria in the intestines, but in the case of irritable bowel disease these signals are affected and result in painful spasms in the muscles of the digestive system. Diarrhea, 1/3 of people with irritable bowel syndrome have diarrhea. Constipation. Constipation is often a symptom of irritable bowel syndrome, affecting 50% of people with irritable bowel syndrome, as well as accompanying abdominal pain, which results from slowing bowel movement, increasing water absorption from digestible substances and making it more difficult. Food intolerance. 70% of irritable bowel syndrome patients indicate that certain foods that cause some symptoms to develop or increase, and these foods may vary from person to person, but there are some foods common to those infected, such as foods containing lactose or gluten, or foods that cause increased gases in the abdomen, and therefore people with irritable bowel syndrome are advised to protect and stay away from foods that harm the abdomen. Fatigue and difficulty sleeping. Half of people with irritable bowel syndrome experience fatigue and stress, and irritable bowel syndrome leads to insomnia, which is difficult to sleep, or frequent waking at night, and therefore not getting enough sleep. Anxiety and depression. Stress and depression are associated with irritable bowel disease, affecting each other and increasing each other's symptoms. The causes of irritable bowel syndrome are not clear to this day. It is not an infectious disease, nor associated with cancerous growth, but there are a number of factors associated with the occurrence of irritable bowel syndrome, including 5 life factors surrounding the patient. Genetic factors. Hormones, where hormonal changes worsen symptoms, which is why the severity of the disease in women is greater, especially at times of the menstrual cycle. Sensitivity of the organs of the digestive system. The body's response to the infection may give the body an unusual response to some infection. For example, gastroenteritis can lead to irritable bowel disease. A malfunction in the muscles that transport food through the body. The nervous system is unable to control the digestive system well. Stimulants of irritable bowel syndrome. There are some stimuli that may increase the problem of irritable bowel syndrome, so it is recommended to track and try to avoid them, and here are a number of the most important of these stimuli. 6. Foods, where some affect foods on some of the symptoms associated with the nervous colon. These foods vary depending on the type of irritable bowel you suffer from. Here is a statement of this: the prevailing pattern of constipation, bread, refined cereals, processed foods, coffee, soft drinks, alcoholic beverages, protein-rich diets, dairy and dairy products. The prevailing type of diarrhea, as eating large amounts of food in general may stimulate diarrhea, and it should be noted that there are some foods that may increase the severity of the irritable bowel syndrome from the prevailing type of diarrhea, including foods rich in fiber, chocolate, and beverages that contain caffeine, alcohol, fructose, or sorbitol, as well as soft drinks, high-fat foods, fried foods, dairy and dairy products, especially in individuals with inability to digest milk sugar, lactose intolerance, as well as foods containing wheat, if a person is allergic to wheat. Anxiety and stress. Exposure to anxiety and stress exacerbates irritable bowel syndrome as mentioned earlier. Medications. There are some medications that may stimulate constipation or diarrhea, such as antibiotics, some antidepressants, and medications that contain sorbitol, such as cough medications. Hormonal changes. Women with irritable bowel syndrome are twice as many men as men, due to hormonal changes in women as mentioned earlier, which is why taking doses of estrogen as part of hormone replacement therapy increases the continuity of irritable bowel syndrome in patients under treatment.